Hi everybody, we have a breast implant surgery, breast augmentation surgery today, and I just want to talk about what we do in the breast augmentation surgery. So I just want to talk about the three topics about the breast implant. So the first one is what kind of implant we use. Actually it depends on the patient's body shape and also the patient desires. And the second one is the incision of the surgery, and I put the incision just under the inframammarian fold, just a little bit below the inframammarian fold, depends on the size of the implant. I just make an incision around 3 centimeters long. So we put the implant, we prepare the pocket for the implant with this incision. And the third one is where will we put the implant? It will be under the muscle or over the muscle. So how can we decide this? We have a pinch test. We take especially over the nipple, we take the skin and the breast tissue and make a pinch test. If it's bigger than the 2 centimeters, so we can put the prothesis just over the muscle, but under the fascia. And when we do the pinch test and we measure it's about lower than the 2 centimeters, so we have to put the implant under the muscle to cover the implant, especially the upper part. And the shape of the implant, how can we decide? So some patients has the volume just over the nipple. If the patient doesn't have enough breast tissue under the nipple, so we can choose the anatomic implants. So the third point is what kind of the prothese we will choose. There's two kind of protheses. One of them is the anatomic shape, is the drop shape, you can see that, and the other one is the round shaped. And especially if the patient choose a good décolleté, we can choose the round one, because the round one has especially the symmetric volume on each part of the prothesis. But the anatomic one, especially the volume is a little bit in the lower part of the prothesis. So if we put this, we cannot get enough décolleté, but a natural look. So we can prefer, especially if the patient has not enough volume just under the nipple, we can choose this implant so we can give the volume to the lower part of the breast. So, and in some of my patients has just a little bit ptosis, and we can use this implant to take the nipple a little bit up, because the volume of the implant is especially in the lower part. So, and another one I use during the surgery, a Keller funnel is made of the nylon material. So we can put the implant without touching the implant. We can put it in the pocket, and so gently we can push it through the incision to the pocket. So without touching the implant, we can finish the operation as we want. So thank you very much for listening to me. See you later.